And she had education in many metro cities because of her father's central government employment. And we were married on May 15th, 1985.
My students and doctors and my colleagues. Sincerely, I am extending my sincere appreciation for your benign presence here. It's my privilege to be here associated with GHF and Suvarna Trust. We gather here with heavy hearts as we conduct this seminar in the loving memory of Dr. Aruna, whose presence, knowledge, and inspiration touched our lives deeply. It is never easy to lose anyone we admire and respect. This event, Dr. Tarnaka is a remarkable professional in homeopathic field and also compassionate soul. It is our responsibility to forward her legacy through sharing of knowledge, collaboration, and dedication to excellence. This event is not an event of learning, it is a celebration of life with her values. We are honoring her legacy in each and every moment of this seminar. Today, I am congratulating all the doctors, students who have chosen a homeopathic profession, commitment, and compassion. Being a homeopathic doctor is a privilege and responsibility. We have to approach this responsibility with humility, compassion, and commitment to lifelong learning. We gather here with enthusiasm and pleasure. Every one of us has chosen a path that demands dedication, resilience, relentless pursuit of knowledge. It is very essential to recognize the significance of seminars in our journey, academic journey. Why should we attend this type of seminars? Let me give some compelling reasons. This is the rarest opportunity to interact with some brightest minds of our society. You will going to gain a valuable insights to revolutionate the patient approach here also. This platform plays very crucial role for learning, collaboration, and inspiration. Moreover, these seminars act as a catalyst for our growth and development. The knowledge gained in this house, not only confined to this house, this will going to have a long-lasting impact in our practice. Varicose ulcers. Varicose ulcers is a common complication of varicose system and poor venous insufficiency, commonly found in the lower legs. Even though it is a painful chronic condition, they bring with them significant implications for quality of life, wound management, and most importantly, patient recovery and long-term well-being. Even though it is a debilitating condition, if untreated, it may lead to serious complications. Being a healthcare professional, we should be aware of its policies, practices in prevention, treatment, and long-term care also. So, coming to the other points already presented by our Dr. Devendra Singaru. Really, their presentations are not only meaningful, impactful, inspirative, encouraging, understandable, truly impressive. Thank you very much, sir, for your invaluable contribution to homeopathic fraternity. So coming to the varicose ulcers, so I don't want to entertain same stuff here again. So coming to the varicose ulcers, there is a seat qualification also important. C for clinical, E for etiology, A for anatomy, P for pathophysiology. C classification also worldwide accepted classification to facilitate the meaningful communication about CVD. But it is but it is the main indication only for clinical score only, for intensity of the disease only. It ranges from C0 to C6. C0 means there is no venous ulcer. It is a long active ulcer. So, coming to the other things also, even in varicose ulcers, role of mutation also plays very important role in varicose ulcers. Because we have to educate the patient and also you have to give instruction to the patients about food also. Food also plays major role in varicose ulcers. Number one, protein is important for vital for tissue repairs. Example, lean meats, fish and legumes. Even C vitamin helps for collagen synthesis and it boosts the immunity. So C vitamin also very important for these cases. Coming to zinc also helps for healing, especially in nuts, seeds and whole grains. Flavonoids also plays very crucial role in treating varicose ulcers, especially berries and green tea. Mostly these are helpful for fast recovery in varicose ulcers. Then coming to the homeopathic management, homeopathy plays very vital role in treating this varicose ulcers because it not only treats the disease as a whole, but it prevents the complications that also stops the relapses also. So homeopathic drugs are very important. It is a chronic sore ulcer, mostly found in the lower legs. Prevalence is 60 to 80% of all leg ulcerations, 1-2% of population. Mostly in the females, age is above 65 years. But academically 65 years, here I mentioned, but I treated many of the cases below 60 years old, 50 to 60 years old. Risk factors are common in varicose ulcers. Commonest is the family history of varicose veins, diabetes, obesity, smoking, immobility, and varicose veins and DVI, deep vein thrombosis, DVT, and peripheral artery diseases, immobility, leg injuries, and pedophilia also. Pedophilia speaker. Clinical features mostly found in the lower limbs, the inside of the legs, just above the ankle. Shallow, irregularly shaped sores, painful, followed, itching, pus, pitting edema, surrounding skin is hard and viscous. These are common features. Complications, loss of mobility, serious infection like osteomyelitis and sepsis, gangrene, loss of diagnosis are you know about it based on the symptoms and physical examination. Examine the varicose veins in upright position and feel the pulse of the ankles. Investigations, venous doctor study, CT scan and Doppler scan to roll out the arterial pressure. General management, managing the other underlying conditions, periodically raising the legs when seated to prevent blood pooling, compression bandages, procedure to remove the debris and dead tissues, regular wound cleaning. Prevent having a healthy balanced diet, maintaining a healthy weight, avoid smoking, staying active with gentle exercises, managing other underlying conditions. Prognosis, timely and effective treatment, there is a full recovery. Recurrence is common at the same site. Then coming to the case report. Patient aged about 15 years, 7 years old, location right lower limb, gradual onset. Sensation swelling, discolored skin, eruptions, deep ulcers, pain, erythema, first discharge, itching, and burning also there. Prolonged standing elevation here, relieved by cold compression something. History, family history, hypertension, diabetes also there, positive DVT also there. Personal history can be touched, craving for refresher drinks, aversions, coffee, peptide food, stools, watery stools, urine frequently increased, sleep disturbed, mental state, forgetfulness of dates and names. Case report I selected from here on the basis of varicose ulcers with impact on fibrous tissues and veins, severe pain aggravated by prolonged standing, red edged ulcers relieved by cold compression, forgetfulness of names and dates. Fluoric acid I selected for this. So, first consultation. First visit, second visit, third visit. Fourth, fifth. After 5 months, this is final report. So fluoric acid I repeated once daily for 5 days. After 2 months, again I repeat same dosage. After 4 months I discarded, then also had healed completely. That's all. First video. Finally, on the basis of reddish deep ulcer, persistent for 6 months, strong offensive, with short pain, sensitive to touch, ulcer also offensive, it bleeds easily, splinter like pain, bone looks like rock. This video is sent by a patient, so TV also. This first video. First visit. Second visit. These are my cases. Thank you very much for the valuable contribution. Thank you. Thank you for giving the opportunity. to share my views. Thank you.
सर चलुतील चल
and not only the post-graduation senior, and while at the time of the post-graduation, first part and second part, and she helps in all the way as a soulmate, and her intelligence, shall I remember that when after completion of graduation, taking gap, once again joining the post-graduation, I got some problem while facing the